Gabriola, often called the Isle of the Arts, is known for its many artisans, beautiful beaches, parks, and trails. Home to almost 4,500 full-year residents, it's easy to imagine Gabriola as an enclave of well-to-do retirees with waterfront homes. But the reality is much different. Like many rural communities, islanders here face particular challenges, especially young families, workers, and low-income seniors. Through a combination of innovative strategies and gumboot grit, this community has risen to meet those challenges through a raft of local solutions. The Gabriola Health Report, which was produced by the Gabriola Health and Wellness Collaborative, provides a snapshot of the island's current state of health and well-being. The data provides a picture of what is working and where we need to do better.
The barriers of being rural and remote and a ferry-dependent community are considerable.
Many people who moved in are quite advanced in age and healthcare needs. At the same time, there's increased pressure on emergency services. In the last year, we serviced about 2,000 patients who were unscheduled. 21% of them were patients who didn't have doctor here appointments.
So Gabriola is not a community of wealthy retirees. We actually have a really large population of working age people, and about 25% of us are living in low income.
We're faced with rising real estate prices, no rental stock, and it's impacting renters, young families, the people who work in our service sector, who we depend on every day to provide services. We invite you to take a closer look to better understand the distinct needs of islanders so we can amplify this community's already energetic efforts.
Mental health is at the core of nearly every social issue on Gabriola. We have high rates of anxiety and depression, and this is further compounded by high rates of poverty. 5 years ago, we had a mental health nurse on the island only about once a month. The services have expanded to include a mental health nurse and a social worker 5 days a week. There's no evening or weekend support, leaving the RCMP to deal with any mental health crises that arise during that time. A further gap is that there's no child and youth mental health supports on the island. A single parent trying to get a child to services to Nanaimo often can't take the time and don't have the financial resources to access services there. If we had more services locally, it would go a long way to meeting the mental health needs of the community.
Gabriola Health Care Center is our hub for primary and emergency care on the island, and we work in collaboration with social workers, nurses, occupational therapists. We currently have 3 doctors and 1 nurse practitioner working and providing the primary and emergency care. Usually when we see our emergency patients, we can treat them and discharge about 90% of them, and that stops them from having to go to Nanaimo to receive the service over there. And this is quite important in a very locked community and saves significant amounts of money for the healthcare system, but also time and misery for our patients. To provide adequate services, we'll probably need about 5 doctors and nurse practitioners to cover all the needs for primary and emergency care. So we have a wonderful urgent treatment center. It has 3 emergency beds. It receives no funding though, and it is supported by our local community through the Health Foundation. And this infrastructure needs funding to continue operating on the current level.
Income is intimately connected to the health of a community. Income affects a person's diet, their susceptibility to disease, their psychological well-being, their ability to participate in their community, and it has a huge impact on childhood development. Many folks on Gabriola turn to our sole social service agency, People for a Healthy Community, for help with meals, and people access that program for a variety of reasons, but the majority of which are because disability benefits and paid employment don't actually provide enough income for people to meet their basic needs. There aren't enough well-paid, full-year, full-time jobs, and income support benefits don't provide enough for people to meet their needs. Most jobs are in the low-paid service sector. We do have a lot of businesses on Gabriola, but we also know that 1/3 of them need outside support to help them make a go of it. We need 3 things. We need governments to increase income support benefit levels. We need legislated improvements in the quality of work and wages. And we need to increase the number of good jobs available through partnerships on community economic development.
When we were putting together the report, I was shocked at the homelessness numbers on this island. 1 in 65 Gabriolans is homeless. Compared to British Columbia, that's 10 times higher and 4 times higher than Nanaimo. We're facing an affordability crisis on this island. We don't have a supply of rentals. 28% of our accommodation is occupied seasonally. That means people have to move halfway through the year to accommodate the returning visitors. So 50% of our renters live in core housing need. That means they spend more than 30% of their income on rent. What we need is to balance the housing needs of Gabriolans with our deeply held community belief in the importance of biodiversity and our ecosystem.
One important factor for Gabriolans' health and well-being are the many trails and parks that give us access to nurturing forests, ocean views, and beach walks. Governments and nonprofits work to protect and preserve the unique environments on Gabriola by acquiring and maintaining parks, holding conservation covenants, dealing with invasives, and urging landholders to voluntarily maintain and restore the coastal Douglas fir ecosystem. On average, 20% of the Gulf Islands are protected, but on Gabriola, it's only 12%, far short of the UN goal of 17% and Canada's goal of 25% by 2025. There are many ways individuals can make a difference. Join an invasives work party, grow native plants that attract pollinators, be thoughtful when taking down trees, or make a donation or leave a legacy for land acquisition for conservation. All of these actions will help.
PhD's gardens are a really bright spot in our food programs. They produce over 400 pounds of fresh produce every year with the help of the elementary school students. Seeing the kids make the connection between themselves, their lunches, the land, and their broader community is a really incredible impact of this program. And right now we are serving about 90 Gabriolans each week with groceries, about 30% of which are children. And along with the groceries, we also provide frozen soups and stews that are made from scratch and delivered to those who have barriers to pick up. Last year, our market coupon program put over $16,000 into the local economy by supporting local farmers while also increasing access to healthy, fresh food locally grown on the island to both seniors and families with children. Looking ahead, PHC wants to redesign our food programs to try and reduce some of the stigma that often comes along with asking for help, as well as we want to continue to use food as a way to build social connection and health improvement for Gabriolans.
Gabriolans continue to create spaces where people can become informed, learn from one another, and establish community priorities, in effect, to govern through citizen action. Instead of waiting for support, this community created multiple citizen-activated networks that fill the missing gaps. All of these initiatives overlap and link across interests, and all have space at the collaborative table. But the supportive threads holding these networks together are held by a few key players. So we are looking to work closely with external funders and decision makers to build on the existing framework and collaborate in problem solving. By leveraging our island-grown talents and abilities, we can achieve positive health outcomes for this community.